Good afternoon, everyone. Welcome to Yashoda Hospitals webinar series. And we congratulations. Last week's we had the finals of quiz competitions, and we heartily congratulate the team. Semi-final like first prize, second prize, and third prize. So we will be connecting you regarding the prizes, and Pratusha will be the single point of contact for further communications. So today we taking a very important topic. It's on everybody's demand, that effective of communication skills in nursing services. We all know in healthcare services, nursing is the first point of contact for every patient from patient arrival to patient discharge. So multiple times they communicate to the patient. So effective communication plays a major role. Like, talking to the patient in a very posh language or communicating them very fluent English, that is not the communication. It is very important to like how much they are understanding, how we are connecting to them. Is there any barriers between communication, what we talking and what they are understanding? So we have to look into the complete barriers, and we have to make them comfortable, and we have to talk in such a way that they should be able to understand what we are trying to say. So effective communication skills is not something science-based it is. We have to connect people, each individual, each person, depending on their way of capacity of understanding what we are talking. In that way, you have to take each patient. Like we know patient arrives, every staff nurse take their personal history, past history, medication history, and we have to explain them sometime what they are further treatment going to do. Suppose simple you are going to for any procedure like IV cannulation, they should need to be explained to the patient such a way that they should be able to understand it. So every procedure, anything they are talking to the patient, it could be simple to simple procedure, it could be anything day-to-day activity. So today we have taken this topic to make them understand better. So always, healthcare industry, any single communication error develops to the error, and error always in healthcare industry leads to the, any sentinel events, or it could any bad clinical outcome. So effective communication helps connecting to the patients, and it gives better clinical outcome and a better patient satisfaction as well. What we are talking and they are not connecting with us, they may not feel comfortable as well. And we can avoid clinical errors as well if you are having effective communication. So keeping all this point, we are trying to make today's presentation very simple, so that all audiences, like they are from multiple nursing colleges and hospitals, they should be able to understand it. And today we are very happy and glad to announce that we made to she accepted our invitation, being so busy schedule. So today's speaker is we are having on the dais Ms. Swathi Meda. She is a group director of Medicover Hospitals. She is having bigger responsibilities. She will be having most of the time busy in her schedule. So thank you, madam, for accepting our invitation as a speaker for today's topic. And I would glad to inform you that today's expert panelist, our Ms. Lisa Leo, she is our principal. She is having more than 2 decades of experience into the nursing colleges. Thank you, madam, for accepting as an expert panelist for today's topic. And even I forgot to tell about madam's background, like Swathi Meda. She is a group director, and she is having almost 24 to 25 years of experience in healthcare industry. She worked most of the corporate hospitals, and she handled all layers of the peoples. I think today we are having the right person for talking today's topic. So, madam, I would like to request you to take the today's topic, Swathi madam, and please start the today's session.
Thank you so much, Dr. Amar. Very good intro has given. I'm honored, and it's my privilege also to take this topic, and it is very much important for healthcare industry. Yes. And 50% topic you have well covered. So I could have been taken not much time for the audience. I know the healthcare fraternity, how much it is important today's topic, especially when we are dealing day in, day out in the scenario like medical, either clinical or whatever it may be, the effective communication. It's a major role for the nurses to play, and my nurses, especially my youngsters, today's outcome, they doesn't know what it impacts and how patient healthcare outcomes will be implied and what kind of success rates will be there with this effective communication. Today, I deal with some certain tips and how they have to overcome these, especially when they are dealing with critical situations and while taking handoff communications. And while dealing with the consultants, while dealing with their coordinators, the PREs, floor PREs or subordinates, either whoever it may be involving in healthcare fraternity, how they have to overcome all the challenges. Today, I'm going to take crisp and small topics and how it will imply on their daily routines. It's a just simple basic methodology which I applied and where they have to focus on more in their daily works. So Pratyusha, can you help me out to slide my, can you share my slides, please?
Ma'am, you can share it on your screen, actually,
Yes, yes.
which you have
Okay,
shared
done.
just below.
Yeah. Thank you. So I think everybody is more eager and interested to know what is effective communication and how nurses are empowered on this and what it does and what is the goal to know about in nursing advocacy as well as effective communication in nursing practice. So today, when you take literature or a nursing research, it is very much important for nurses. Today, world is leading effectively entire nursing empowerment or nursing leadership skills place, even if you take a in charge or a nurse team leader, or if you take a staff nurse, it is very much important to empower yourself, and nursing advocacy and effective communication is very important tool to reduce especially patient errors and to make a patient life very, healthcare today in the world, you can prevent errors and you cannot do harm for the patients. That is the primary goal why nurses should lead as advocates of effective communication is very much important. So my nurses, especially primarily nurses, may speak behalf of their patients and collaborate with their healthcare team if any problem occurs. They should walk into the patient shoes and understand that it is very much important, to understand their pain points and where they have to be coordinate and collaborate with the team. That is very much important in the healthcare system. And effective communication advocates defend of choices and rights and privacy of patients. That very much important. As a nurse, the primary responsibility as you need to have advocacy with medical facility, advocacy with legal system, advocacy with families, and the ethics of patient advocacy in nursing, and key skills for nurse advocacy and become a nurse advocate for patient. If you don't have effective communication, you cannot deal with medical facility. Like a nurse, a staff nurse who all are you today joined when you have done induction for her, okay, any problem occurs. This is the where you have the SPOC nursing supervisor 24/7. This is the manager on duty. You can reach him. He will be able to help you out. She'll be able to help you out to reach that escalation, and effective communication is very much important to deal with them. That advocacy skills and empowerment, we as a leaders should proactively in the nursing induction system itself. Even I think ma'am principal is with me, Miss Liza. She also will definitely agree with me. That is very much important during induction itself, during theoretical teaching itself. We need to involve this system. So how nurses are empowered in the legal system. If the case records, especially while dealing with effective communication, even NABA, JCI, everybody says about it is very goal to IPSD goal to effective communication, where they deal and how legal impact will help for the organization, how they have to prevent error on patient care, especially while taking a handoff communications or while dealing with critically ill patients. If the critical value report immediately, if they don't escalate, what it will impact and how patient will be deteriorated and how it become into cardiac arrest. Early morning signs, early morning warning signs are very much important. If nurses could not able to monitor that early warning signs, patient will be deteriorated and immediately patient may go into cardiac arrest or neurogenic shock. Any might be happen. Patient may impact onto the ICU, landed up with the cardiogenic shock or neurogenic shock or a respiratory arrest. It will be a legal issue. Sometimes patient attendants may feel that the care was not taken care. The appropriate nursing was not able to know that is critical value. She has not raised the voice to escalate to the consultant. The critical value is very much important. This legal compliance will arise. Advocacy with families. Any information you are dealing with, the aided scripts are very important. You need to give assurance that I'm the nurse. Okay, I'm taking care of you so and so time. I need to know about your condition. If you have any problem, please deal with me. How you wanted to know what kind of this is the procedure we have been posted for you, sir or ma'am. That professional etiquettes and behavioral aspects and your procedure will be taken care at 10 o'clock, and we will be keeping you in NBM, and don't eat any food, and the doctor will let you know what time we will be shift you, the OT. These all things very much important to guide them and to handhold them. That ethics are very much when you are dealing with patient care. That is the main primary goal, that ethics should be followed. Key skills for nursing advocacy, like a nursing advocate for patients, how you deal with your other coordinators. Especially the nursing is the 24/7. Every doctor will say that nurses are the backbone of the hospital. But in this front forum, I'll tell nurses are the front bone of the hospital. People they deal every day, day in, day out, they deal with such kind of people with effective communication. What nurses have fostered, they have to have advocacy skills and empowerment. They do deal with the patient, they do deal with the nursing departments, they do deal with the doctors, they do deal with the billing community, they do deal with insurance team, they do deal with the lab people. They will also quick decision making, like how patient life, as a scenario which I said, critically ill patient, if the critical alert is going wrong somewhere, the potassium is aggravated, immediately how they have quickly to respond. So that decision making is very much important. Proactively she need to act and she need to inform the critical care doctor. That's kind of decision making. They need to deal with the insurance team and a lot of policies and protocols. They have to entitle, okay, this is the ICU patient. What is the admission criteria, discharge criteria, trans-in criteria, trans-out criteria? These all things the nurse should aware during induction itself in the college. The basics should be taught thoroughly, and they need to effectively communicate to the patient and patient family as well as the coordinators, and with a collaborative team approach that comes under OT. Any concerns, any religious beliefs, anything if they have patient, that we need to take care. And the safe environment and safe practice is very much important. The effective communication plays a major role. Why it is important? Communication. That is, foremost, communication is a two-way process of exchanging information and ideas. Very much, my audience, please understand the communication two-way of process. The exchanging of information and getting ideas. Listening skills should be there. You can't argue or you can't please other person what he wanted to communicate and how he wanted to put his brainstorming and what kind of idea process, thought process he wanted to give. That collaborative team approachment should be there. It also creates maintained relationship. If you don't effectively communicate, the communication gap between the coordinators, especially the flow PREs or a housekeeping team, either people who are dealing in the patient-related nursing services, one nurse to other nurse, the communication, if you are failure to communicate certain things, it creates a lot of mismanagement of patient care, as well as a lot of errors will occur. And out of 100%, whatever you want to communicate, if you don't deliver the message to the other colleague, it may harm to your patient. Over 75% of our time is spent in interpersonal situations. So that is very much important. The communication, if you don't communicate thoroughly, that's a very major chunk in healthcare industry. Why we need to have effective communication skills? What are the components and contributing factors we need to have in effective communication skills? Looking and listening for cues. Asking open questions, using pauses and silences, and clarifying the doubts, and reflecting what other person is talking and how I have to reflect. Listening skills, good listening skills, and acknowledging what other person was conveyed the message, how you are acknowledged, whether it is been passed information to other person, who all are responsible. That is very much important. Summarizing, like in effective communication, you need to know, summarize the matters, whatever it is which is relevant, which is important, you need to summarize. It should be concise and crisp. In my next slides, it will be detailed. I'll deal with it. Empathizing, paraphrasing, checking of information, giving small amounts of information at a time, and avoiding jargons. Please don't use jargons, especially while you are dealing in healthcare industry. That is very much important as a healthcare fraternity. So I would like to enhance a lot of things. Why communication important in nursing, and who all are people are required, and what is the effective communication, how it deals in the healthcare industry. It is the essence of healthcare. Make positive impact on client and family, impart knowledge on health practices. Communication is the essence management. If you don't have these kind of qualifications, especially while dealing with effective communication, we may do a lot of errors, especially in the impact on patient healthcare and as well as patient safety and quality. And it impart knowledge. If you don't deal with effective communication, definitely it will impart on healthcare practices. That is the reason communication is very much important tool to deal with. And there are choice of communication modes. How you deal with day in, day out, every day. There is a verbal communication, written communication, and non-verbal communication. These are very much contributing factors while dealing effective communication. If you don't apply this thought process or this theologically, verbal communication or non-verbal communication, written communication, and listening skills, and last, that was the visual communication. This is all will contributing factors to communicate effectively, to do the nursing practices every day, day in, day out, how you are in par with the patient information. So why communication is integral part in nursing? Acceptance, trust, why we should have that acceptance and trust. It is a vital to gather information from client, and it is definitely any nurse, if they are working on floor, so she should know the complete information of the patient history taking. As Dr. Amar mentioned, she should know about entire his patient or her patient condition. He or she should know about complete client, what he is going through, what kind of comorbidity disease conditions he is having, whether he is diabetic, whether he is hypertension, what kind of comorbidity, like if I can give this kind of diet. These all things as a nurse, you should know a complete information about your client, and confirm facts from the relatives. If sometimes the patient could not, like a client could not able to answer your questions, or sometimes he may forget to tell about his own history, you can even cross-verify with the relatives whether he is diabetic or he is on any acetylcholine tablet post CABZ case, or he is on any warfarin. Such kind of information day in, day out, when you're dealing with the patients and patient attendee families, you can ask the relatives what kind of drugs he is taking for the hypertension, what kind of medicine he is using for diabetic. These are all very much important to identify health disability. Whether patient is having any hearing aid, or whether patient is having any dentures, or patient is having any other health issues, we need to check with the relatives to develop the acceptancy and create that confidence and trustworthiness. That is very much important as a nurses we need to have in our practice. So why we are privileged, this information is very much important. Great value in making nursing diagnosis, confidentiality of information. This is very much important as a nurse. Even nursing process we learned in our fundamentals of nursing. As a nurse, if you are not taking, like you are not privileged to know the patient history or condition, you may do errors. Now we are giving a lot of importance in nursing care plans, nursing process steps. Like we learned in fundamentals of nursing, like assessment, okay, planning, goal, diagnosis, nursing diagnosis, implementation, evaluation. That is our process, how we need to apply. We used to write a lot of cardex in internal assessment. But when we come into practice as a nurses, I am not able to practice my nursing such a way that I need to take care of complete information. I need to gather patient history, taking complete assessment, and I need to plan my patient care. I need to have goal, how I have to reduce his pain. If a patient is having post-surgical pain, the pain score is like 9. Why my pharmacological medicine is not working? How I have to do as non-pharmacological nursing interventions? I need to go to the patient and do some physical, exercises, emotional well-being, and you need to encourage patient to read some Bhagavad Gita or a Quran or some kind of spiritual or religious language you can encourage. Sometimes you entertain the patient to see the watching TV, some kind of non-pharmacological pain diversional therapy. You can do hot water therapy, cold water therapy. This is all very much important in nursing diagnosis. And your goal is to reduce pain from 10 to 1. That is your goal. That interventionally, not everything will work for medicine. As a nurse, what you are doing bedside, that is very much important. So this is give great value for the nursing process. That is the reason effective communication plays major role, and you are a privileged nurse. And confidentiality of information, that is very much important. Any patient information we can't discuss with other people, or we can't talk openly in the public corridors. We cannot discuss anyway. That confidentiality is very much important. Health education, educating client and family, health practices, continuity of care and follow-up. When you have this nursing process steps or a clear-cut nursing care plan, you have what to be done, what not to be done, and what should be followed, how you have to outcomes in the critical care, like a patient with critical care, what kind of outcome he will be expecting, what is the average length of stay with this diagnosis. And as a nurse, you have to have privilege to know complete information, and you check with your doctors. Doc, please help me out. How I wanted to know the patient is getting, de-escalation of antibiotics. How I wanted to involve in the treatment parameters. Why you have change of antibiotic. This is very much important. As a nurse, you need to privilege and you need to ask complete information from your doctor. That is there where effective communication plays a major role in nursing practices. So when you are dealing with effective communication with any person, either your colleague, either your subordinate, either you're a doctor or you're a team worker, you need to have this kind of body language. 3 C's are very important to maintain your effective communication. It should be a context, culture, consistency. Whatever you are speaking, the context, it should be concise and crisp. People should understand. Other person should understand what you wanted to deliver your message. The culture, you have to give a lot of religious respects and cultural values. That is very much your body language and your body behavior will impacts on you while you are dealing with effective communication. Consistency, what you wanted to convey the message to other person, how you wanted to deal, that consistency should be there. You can't use, as I said, jargons, or you cannot use harsh post languages. That is very much important what you are communicating other person. It should be clear and it should be understandable and easy language, and the culture should be the religious or anything spiritual, whatever you wanted to add according to their language. If a patient comes under Marathi, you need to speak his, if you don't know Marathi, you can get interpreters to understand his emotions, understand his, that very much important. The consistency also very much important. As a staff, when you are dealing with communication, especially the effective communication day in, day out on our ground practice, my staff nurses will do it always, different levels. Sometimes there is a staff nurse to team leader. Okay, but especially when you are dealing the care, especially quality of care and safe care, when you want to deliver, you need to have proper, hand of communication, how your patient care is impact, what you have done in night duty, what patient was deteriorated, if patient deteriorated, how you have been reacted, if any critical lab value comes, how immediately you escalated, what is the turnaround time to close the patient, like if a patient is hypoglycemia, sugars has fallen down, how you immediately proactively involved in the nursing care, how you have immediately escalated to the doctor, and what kind of measures you have taken, what is the output for the patient, whether patient been treated in the ward or patient is been shifted in the ICU, what kind of proactive nature you have done. That should be hand of communication is very clear, especially when you are dealing with hand of communication and critical value lab policy. This effective communication plays a major role and impacts on patient healthcare. And staff nurse to subordinates. These are all the examples which I'm giving lively. Every day we face this kind of problems in our effective communication, where our nurses will not follow certain etiquettes. Not every nurse, I'm saying. Certain nurses, they doesn't know whom to escalate, how to sort it down the problem immediately, how to take quick decision making and proactive nature. That should be very much important through your effective communication. So staff to subordinates, as an in-charge nurse, as a team leader, okay, you need to have communication book, every register, whatever your senior leaders are telling or whatever your educators are educating, whatever your senior personnel, especially your nursing heads or a nursing superintendents or whatever policies has been created for the hospital, it should be educated and it should be, translated to your subordinates. And this is the policy we have created today. There is some mislapses are happened in the patient care. When I audited, when I do RCA, root cause analysis and corrective action, this is the corrective action we have been find out. And this is the preventive action. Next time this is error cannot be happen. And this person should go to education. Re-education should be done and reassessment should be done by his privilege, and re-competency should be evaluated, whether he could be able to do individually, whether he need any assistant or whether he need any supervision or whether he can able to. That competency matrix plays a major role when you are dealing with subordinate, when they do any errors in patient care. That is very much important. And much of communication at this level for directing and delegation of work. When you're delegating the work, especially when you're subordinates, make sure that they are confident enough to handle any situation and they independently do that. If you have that kind of competency people, you can able to deliver. That's your effective communication place. How the staff and superiors, especially this is already I have explained, when your senior leaders or nurse educators or infection controllers, when they come for rounds, when they are dealing any policy, if deviated, some kind of hierarchy level, if they deviate the policy or protocols, you need to correct them. You need to observe them, what they have done, why the mistake was happened. That root cause analysis and corrective action, preventive action should be done. If this could have been, don't shout people in public and don't show your attitude or behavioral aspect. As I am a senior or I am a superior, you cannot out or you cannot scream it in front of the people. You can call them for the separate into the room or you ask your clean utility if you don't have time to take them into the room. Closed door room, and you make him understand her mistake. This is your mistake. You have done this mistake better. You need to know this, and you completely, escalate. If you don't escalate critical lab value, the patient may harm and he may go into vasovagal hypotension. Sometimes, hyperkalemia or hypokalemia leads to ectopics, and patient may go into cardiogenic shock, and we cannot retrieve the patient. This is what your mistake where you have done, and you need to go for education. You need to understand what is the process of, critical lab value policy. What it is, that much kind of assurance you need to give, and you need to, any policy deviation in the hospital as your senior was led, and if we couldn't able to reach, we need to correct as a seniors. That's, maintain the hierarchy levels in the organization. It means every member should maintain that respect. That is very much important. With the client, how the nurses will deal in client, that is very much important, especially when you are dealing with, I said, aided scripts. You need to handhold the patient from OPD to till discharge. You need to handhold the patient. How I have to explain what is the policy, like when patient comes in OPD, when doctor suggested to admit, what is the admission policy, why he has got admitted, what kind of, barriers in that, and where he has to be, whether it is a diagnostic procedure, whether it is a medical management, whether it is a surgical intervention is required, how you wanted to communicate, what is the outcome out of this procedure, you need to explain. If you want to explain those things as a person, you should know a complete information about your client history. That is the reason nursing process and nursing care plan, where I told it is very important. When you are dealing with the patients, especially effective communication in nursing process, as I said, handoff communication, take a critical lab value policy, take a quick decision making, or take a quick, proactive nature, or being a BLS nurse or a ACLS nurse, you need to have these 7 C's are very much important as a professional nurse. Not only dealing with any procedure, as a professional person, anybody, you take any healthcare employee, not only nurses, everybody should know what is importance of 7 C's communication. I just give certain examples on these 7 C's. Completeness, conciseness. Your communication should be complete information. When you are dealing patient care, healthcare industry especially, the communication should be completely, you don't, hide any information. If something wrong happened or some incidents happens, human errors will occur. Bounds to be happened incidences in hospital. Cannot say 100% we are right. Sometimes it may bound or it may lead to happen incidences. Please don't hide any information. Tell that assurance. You have to create that safe work culture to the people, especially while nursing team. Certain times they will hide the information. Certain times they will not document appropriately. They may not even communicate to us. That complete information should help your effective communication process, where you can deal better way in the patient outcome. That is very much important. Conciseness. Your information should be concise. It should be understandable, and other person should be easily accepted, and your information should be reach up to the mark, like point to the complete that case only. You can't deviate, you can't add unrelevant informations into the case process. That is very much important. And consideration. Okay, this nurse does a mistake and she accepts it, and she has been escalated, and she has considered that she has to go for training. She doesn't know how to deal with this patient care where I have given for the patient care. She should be accepted, and that consideration sometimes you need to understand. Clarity. Whatever communication you are communicating to other person or your colleagues or a doctor, the clarity should be there. Don't hide anything. Again and again, I'm telling the complete information, clarity. You need to give clear picture what happened yesterday night, why patient was deteriorated, why you haven't checked Mio score. This is very much important to give a person complete information as a clarity. Correctness. Okay, you have done mistake. As mistakes are bound to happen. So how we have done? Root cause analysis should be done, and you have to do the CAPA process and correct the person. Like any person does mistake, you need no need to hide the mistake. Understand his point of view, or his lack of awareness, or lack of knowledge, lack of skill, or lack of technical, impact where he couldn't able to train on that. We need to correct the people. And courtesy. Courtesy is very much important being a leaders. that we need to have. From the team leader, you need to have courtesy. Don't show, as again I'm saying, don't show your anger into the people, and don't shout on in front of the people or corridors anyway. That is very much important. Empathetically, sympathetically, you have to deal with the person. That courtesy plays a major role as a leader. And concreteness, whatever you wanted to tell, it should be confidential and concrete. Complete information. Should anything happen on patient care, you need to have complete picture. Okay, this was happened. That is the reason a nurse does a mistake. That is the reason, if a lack of knowledge, a lack of skill, lack of talent, that is the reason he couldn't able to perform. That concrete information you should know as a nurse in an effective communication. So what are the barriers to effective communication, like physical and environmental barriers? Already I have been explained. Difficulty in hearing, okay, not being able to see gestures or postures, etc., or lack of privacy, no control over who is present, staff or relatives, or physiological barriers, or health conditions, cold, blocked ears, or fever, exhaustion. Sometimes our nurses, they may feel sick, they may not be able to come for duty, but still they have come, they couldn't able to deliver appropriate care, and they may fall, especially tenderly, fall on sleep, and they may not able to give 100% delivery of work. Sometimes physiological barriers, sometimes they have physiological barriers also. Their health is not cooperating. Sometimes they have dysmenorrhea, cramping pains, or sometimes mental disturbances at families. Everything it is psychological and physiological. It impacts on barriers. Lack of privacy, as I said, no control over who is present, staff or relatives. Sometimes we lose our temper, our angers, and without seeing in the environment, we lose our, we show our gestures and we throw words and we abuse them and we talk whatever I like. That is very much important to avoid these barriers in the physical and environmental. And psychological barriers, expectations, prejudice, and assumption. Don't assume, okay, this could have been done, I could have been, madam, I have done. Sometimes when we call for them any mistake they did, they prejudice, I have done, I think this kind of prejudice, or I feel. Don't use this prejudice or assumptions or expectations. The patient care is very much important, and you need to create a safe environment and quality of care. You can't work with prejudice and assumptions and expectations. That is very much psychological barrier. Fear of being judged as a weak, okay? That fear factor, as I said, as a new nurse, new novice joined, and she has a fear to escalate. If some problem comes, okay, we need to create a healthy environment to work, or any problem happen into that ward. Please escalate. That should be a judged, and it should be correctly communicated to her or him. This is the mistake you have done. That fear, don't take fear. We have instant reporting system, beautiful culture in our hospital. We will raise incident and we will send you for training. If you don't have, don't know that I will be taking care of you for the education department and we will train you. That kind of, confidence we need to gain from the nursing. So that fear factor we need to take out. Personal barriers and moods, likes, dislikes, sometimes thinking it's not my job, or assumption patient will get more upset. These all things are very much important psychologically. Sometimes if they have dysmenorrhea, they may doesn't like to work and they may come for the duty, but they do a lot of mistakes. Thinking it's not my job, throwing somebody's coat. When something is taken up, why? Okay, I need to escalate. Okay, might be a PRA job. It might be a housekeeping job. It is not a great rocket science behind it. I can even communicate, okay, this patient is getting discharged. Room is clear. Please kindly come and, clean the hospitality should be done. That should be escalated to housekeeping supervisor. That job only should be done by PRA. Why I should take this kind of jargons you have to avoid. Assumption patient will get more upset. Okay, sometimes if you don't follow these kind of psychological or physical barriers, patient may definitely accept, they feel that we are not given. So finally, I would like to give conclusion of this effective communication. Like I have given a lot of examples. So my take home message for the new novices or my nursing fraternity, communication skills are important. That plays a major role in our professional life, from understanding our client to make a perfect problem solving approach. If you don't know about our patient complete history, we are not able to deal with a day in, day out our patient care. That is the reason you should know complete information. The 7 C's are very much important. As I said, clarity, correctness, conciseness, courtesy. This is very much important day in, day out of your daily practice. So that's you please remember these points, and it can be said that awareness of these 7 C's effective communication make you a good communicator and good professionalist. This is what I would like to enlighten. So I just take a thought of, one quote which Brain Tracy said, communication is a skill that you can learn. It's like riding a bicycle or a typing. If you are willing to work at it, you can rapidly improve the quality of every part of your life. So my dear audience, I think I have done justified my topic. So you have any questions, you can post in chat box. I'm ready to answer. Thank you so much, Dr. Amar and Dr. Pratyusha.
Thank you, madam. That session you made very simple and concise, and I think you kept everything scenario-based day-to-day practices. That's how that like staff could have been, easily understand. Most of them are nursing college students. Any queries are there? Please put into the this text. We'll get back to you. And you made it very, step by step, all sequences as well. And this is not only into healthcare industry. I think day-to-day practices in personal life as well. Communication skills, resolves a lot of conflicts also. So I think everyone has to practice it, as madam said very well. It is not a something, science, it has to be skills. You have to practice it. It cannot be done overnight. It is not like that today you had this session and tomorrow you'll be perfect. So
Correct.
this, just a guidance, this presentation today. So where you need to focus generally, where we generally go wrong, what are the barriers. Pratyusha, do you have any, shall we take question after madam's overview on this today's topic, Lisa madam? Can you just give brief on today's topic, Lisa madam?
Yes, good evening, Dr. Amar and Ms. Swathi and Pratyusha. First of all, thank you all for giving me this opportunity to be the expert panelist of today's session. Actually, this is a very, very catchy topic because communication is something that we see, and we experience every day, especially in our nursing service practice life, I would say. Professionally, if we take our students, as you said, most of the people who are the audience here are college students, are nursing students. It happens that every day they communicate with the patients. And the placement of the years in the curriculum and the syllabus as well, everywhere you see a part of, communication coming up, starting from the first year onwards. But still, we think that we really need to work out on how we communicate with our patient, which is very, very important. So here, Ms. Swathi has really elaborately explained about how communication should be and the theoretical perspectives. Here, I would just like to give an overview about, what are the benefits of having an effective communication. See, actually, there are several hospitals available in the market. Anywhere the patient goes, every nook and corner, there is a hospital. But why would a patient go to a specific hospital? That is very, very important that we need to understand here. The thing is, a patient is looking for good care, good attention. So that is a major part of a nurse in a particular hospital. The patient should feel comfortable in communicating what exactly he or she wants. So that is the major part of, patient feedback as well. The patient survey, patient feedback is very, very critical in a hospital. So these are the aspects that I would like to really highlight today in this session. The next thing is, whenever there is an effective communication, it happens that there is high quality of care, isn't it? And the next part is that we are attending to all the special needs of the patient. We are looking into what is essential pertaining to the particular patient. Then whatever changes need to be done with respect to the care of the patient. So we have an opportunity of tracking the changes of communication, isn't it? Next thing is, Madam was talking about advocacy. That is a very, very important part nowadays, because what is this advocacy? Advocacy is nothing but talking for the patient, being for the patient, isn't it? Like, we have a very therapeutic relationship with our patient. So whenever there is a part of decision making, we stand by with the patient in understanding what he really requires, and also stand with the healthcare members and understanding what is actually essential for the patient treatment perspective. So these are the important aspects that we really need to understand, and what is this communication, how effective it can be, how beneficial it can be for the patient as well as anybody pertaining to a person who's working in the hospital. So that is something that I would like to highlight here. Then Madam was talking about the barriers of communication, which is, yes, we really have to work on the barriers, because here Madam was specifically talking about using jargons, and here she was talking about using unfamiliar terminologies. So we tend to have, our students have the habit of, using all these terminologies while talking to patients. So we need to make them understand that, make your language very simple for them to comprehend. The next is, see, we have patients from different parts of the country and even different parts of the world. So there are a lot of cultural differences that exist in the patients that also needs to be considered, which is actually a very big barrier in communicating to the patient. So Madam was talking about a Marathi patient there. We should have a translator in between if we really cannot understand this particular patient, what he would like to really communicate to. Next is the perceptual differences, then the physical differences, the ethnicity, the race of the patient, and then the sex of the patient. All these things are actually real barriers that we could come across during communication. So here, I would also just like to highlight some of the clinical tips that we could utilize during this communication process. So see, let me just explain a case scenario where a student nurse is there assisting or performing a catheterization procedure. You know how catheterization is. It is a procedure which is very, 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 arduous for the patient and kind of very apprehensive to the patient as well. So before starting the procedure itself, you're just going to the patient and just removing the drapes of the patient and starting to catheterize him is going to make him very scary. He's going to become apprehensive as to how you're going to do this procedure and what is really going to happen with respect to this procedure. So I feel that, every step of this procedure should be narrated to the patient. So the client is very comfortable, is very calm and at ease while this procedure goes on. And eventually he's going to understand as to how this procedure is going to be beneficial to the patient. So that is one particular case scenario that every student nurse from the first year, undergoes and needs to understand that explanation of procedure in a very simple way is very, very important. The next thing is with respect to the nurses madam was talking about, it happens that she has her own frustrations. She has her own, pressure during the work. So it happens that sometimes the nurses go and ventilate all these things to the patients. It happens that she keeps talking that she's been overloaded and she's been overexhausted or there is always a burnout. So that is something that we shouldn't encourage. We should talk to our student nurses, and madam was talking also about the induction training program during which we need to reiterate on that they shouldn't be doing that to the patient. So that is something that I would like to talk about with respect to this effectiveness of communication. The next thing is that, whenever we go near a patient, sometimes, based on prioritization of care, it happens that we don't have time for that particular patient at that moment. So it happens that, we need to tell them, we need to talk to the patient and tell them that, yes, I will give you, I will give priority to your care. And I think some reasonable time frame should always be given to the patient. For example, you say within 5 minutes or 10 minutes, madam or sir, I would get back to you, or Mr. So-and-so, Mrs. So-and-so, I would get back to you. Or just in case if you're not able to get back and you're sure that you're not able to manage the situation, at least at that time you should be able to tell them that, yes, I would make sure that somebody is going to attend to you, attend your care. That is something that every nurse should reassure while doing this particular, communication process while handling the patients. That is very, very important. Next part madam was talking about is about the body language, which is very, very, very important. At times we don't teach our nurses how to behave in front of the patient. The thing is 55% of language or communication is through non-verbal communication, and around 38% is actually vocal, and around 7% is only in words. So the way you stand, the way you lean in while listening to your patient, and the eye-to-eye contact with the patient is very, very, very important. And always when the patient is speaking to us, do not look somewhere else, because most often I have myself being a patient seen that patient nurses always are only writing. They are always documenting whatever we are telling before they could even look at us and have an eye-to-eye contact. So that actually disinterests the patient, and there's going to be a negative effect of all these, repercussions that comes up, after which, cooperation from the patient is eventually going to become difficult. So we need to understand. So, an open posture, an open palm, the leaning on, active listening, not interfering in between the conversation, and being very patient in listening to the patient, I think that would make communication very, very, very effective.
Thank you, madam. I think this today's session, I required one more session to take it further. Very interesting topic. And we're trying to concise into 20 minutes, between 20 to 35 minutes. So I think any questions, please put into the WhatsApp or this thing. We'll get back to you. Right now, there is no questions as such. So they are showing more interest. We'll have one more topic on healthcare communication. It's a very vast subject actually. So today we try to keep it limited to the nursing. Overall, we'll take next topic into the healthcare communication in detail. Thank you, madam, for joining for today's. Lisa, madam, yes, as the expert panelist, no, I should give more time to you, but you're running
Thank
out
you,
of
sir.
time.
I
Madam,
have quite a lot of points to share actually,
yes,
which would
yes.
really benefit all my
we
students.
are keen to listen also because you're giving practical scenarios where they can improve. So we'll have one more session in this. Madam, thank you so much
Yes,
for
Dr.
being a
Amar, if
speaker
you
for
take
today's
20 minutes
topic.
on effective communication, it may not sufficient for
Yes,
especially
we
while
felt
dealing
same.
healthcare industry.
That's why I kept
As
in point of
Dr. Ms.
nursing.
Lisa said,
If you put
really we
healthcare,
need to deal
it
the
is going to
nursing
be very
students.
vast. Yes, madam.
Thank you so
madam,
much.
for being
Thank
today's
you, sir.
moderator.
Thank you so much.
Pratusha, thank you for being today's moderator and Pawan and digital team completely. Thank you so much. Anything you want to say, Pratusha?
Nothing, sir. Thanks.
Thank you. Thank you.
Thank you. Thank you all
Thank you
once
all.
again.
Thank you.